SB 912 first reading taken.
The Nigerian Senate on Wednesday, October 15, 2025, took an important step to improve care for sickle cell disorder nationwide. This was as a bill to establish sickle cell disorder research and therapy centers across Nigeria's 6 geopolitical zones and the Federal Capital Territory successfully scaled its second reading in the Senate. The bill, titled A Bill for an Act to Establish Sickle Cell Disorder Research and Therapy Centers to Expand Access to Specialized Sickle Cell Disorder Care, Improve Data Collection and Research, Support Education and Assistance for Patients, Families, Providers and Communities Affected by Sickle Cell Disorder, and for Related Matters 2025 was sponsored by Senator Sunday Katung. Senator Katung said the bill was to expand access to specialized care, improved data collection, and enhance education and support for patients and families affected by sickle cell disorder.
Objectives of the bill. The objectives of the bill are to 1. Provide a legal and institutional framework for the establishment of 6 sickle cell disorder and therapy centers, with 1 in each geopolitical zones in Nigeria, and to provide for the due management and administration of the sickle cell centers. 2. Provide facilities for diagnosis, curative, rehabilitative services for sickle cell disorder, as also improve access to specialized sickle cell disorder care.
Chief Whip of the Senate, Thaya Mongono, called on relevant agencies to sensitize the public on genotype compatibility before marriage to prevent transmission of the disorder.
One of the causes of the sickle cell disease is mismatch of the blood group between the two parents. So once there is sensitization, and then this test is being done, where the blood did not correspond, then I think the marriage should be aborted instead of bringing untold hardship to the parents.
Other senators described the bill as long overdue and critical. They highlighted the genetic nature of the disease and the urgent need for public awareness about its causes.
And I don't think we have paid attention to this enough. So this bill is completely timely. It will have come before now, but no time is late for us to have centers where we can provide therapy for sickle cell patients.
Chief, with that, let's do the prevention, even along with the cure, because most people don't even know the genotype. Even here, when you do sample, people don't even know their genotype. You see AS marrying SS, it's risky. Or SS and SS, it's risky. So prevention is far, far better than cure. It's always better than, you can even be an SS and marry AA. They will tell you, but most people don't even have the enlightenment and the education to even know whom to marry.
Here is that rather than establishing them as isolated centers, they should be made appendages to the university teaching hospitals in these 6 geopolitical zones. This is mainly to strengthen and broaden and also deepen the research and the therapies. Considering
most children die in their early stages, sometimes 14, 10 years. But the important thing here is that we need to combine palliative measures with educational enlightenment of parents. Before marriages, couples should be encouraged to go and get their genotype tested and established.
Deputy Senate President Jibrin Barrel put the bill to a voice vote, and it was passed for second reading.
I commend Senator Marshall for bringing forward this bill. It's something that will try to find succor for those who are suffering for this unfortunate ailment, which they inherited from their parents. And as the bill moves further, we should try to encompass the idea of prevention so that we will not have more of those who will be suffering from this disease in the future. And we should find every way possible to get succor for those who are having this ailment.
The development marked a significant legislative effort which addressed sickle cell disorder through specialized centers strategically located across the country.
Mr. President and distinguished colleagues.